wrong. There is a good chance this is sitting in your medicine cabinet right now. Paracetamol is without a doubt one of the most common drugs in the entire world. But that familiarity, well, it can be a bit of a trap. So today, we're doing a deep dive, explaining exactly how to use it safely, and, just as importantly, what to do if things go wrong. Here's what we're going to cover. First, we'll look at why it's such an everyday go-to. Then we get to the really crucial part, how that safe medicine can become dangerous. After that, we'll decode the warning signs to watch for, lay out the absolute rules of safe dosing, and finally, walk through the critical steps to take in an emergency. All right, let's kick things off with Section 1, the everyday painkiller. We're going to get into why this is a staple in pretty much every home. I mean, just think about it for a second. You get a headache, a fever, some minor aches and pains. What do you reach for? Chances are, it's paracetamol, or, acetaminophen, depending on where you live. It's trusted, it's effective, and it is everywhere. But that's the thing. That very familiarity can sometimes lead to a bit of complacency. And that leads us perfectly into Section 2, when safe becomes dangerous. Let's really look at how this medicine we all trust can actually pose a serious risk. So this slide really spells it out, doesn't it? There's a super clear line between using it safely and misusing it. Over on the left, you've got the intended use. Take the right dose for just a few days when you need it. Simple. But on the right, that's where the trouble starts. Taking too much, mixing it with alcohol, or, and this is the one that catches so many people out, taking multiple cold and flu medicines without even realizing they all have paracetamol in them. That's how you can accidentally overdose. So what should you actually be looking for if you're worried? That brings us to Section 3, decoding the warning signs. First up, the common side effects. Now, I should say, these aren't actually that common, but they can happen. We're talking about things like feeling a bit sick, some stomach discomfort, maybe a rash. Generally, these aren't a cause for major alarm, but it's good to be aware of them. But, and this is a really big but, some side effects are absolutely not mild. They are urgent signals for your body that you need medical help right away. And this is where we all need to pay very, very close attention. It really boils down to 3 major types of severe reactions you need to have on your radar. The absolute biggest risk is liver damage. Then there's the chance of a severe allergic reaction. And finally, some very rare but serious skin reactions. Let's break each of these down. Okay, liver damage is the #1 concern with taking too much paracetamol. The warning signs are super specific. We're talking pain in your upper right abdomen, yellowing of your skin or the whites of your eyes, that's called jaundice, dark urine, and just severe nausea or feeling incredibly tired. These are not symptoms you wait out. They're red flags. Next, an allergic reaction. This is a stop everything and get help kind of emergency. If you get any swelling of your lips, face, or throat, if you find it hard to breathe, or if you break out in a really bad rash or hives after taking it, you have to stop taking it and get medical help immediately. I know this all sounds pretty scary, but here's the good news. It is almost entirely preventable if you just follow the rules. So let's get really practical with Section 4, the rules of safe dosing. Okay, please listen closely. Here is the most important number in this entire explainer. 4,000 milligrams. That is the absolute total maximum an adult should take in a 24-hour period. If you remember one thing, please make it this number. And this table here is basically your cheat sheet for staying safely under that limit. A normal dose is 1 or 2 500 milligram tablets, and you take that every 4 to 6 hours. But the golden rule is you never exceed that 4,000 milligram daily max. And it's worth pointing out, if you're taking it for a longer period, a lot of doctors suggest staying under 3,000 milligrams a day just to be extra careful. Now, you also have to be way more cautious if you already have any liver problems or if you drink alcohol heavily. And I'm going to repeat this one more time because it's so important. Always, always check the labels of other medicines you're taking, especially those all-in-one cold and flu remedies or other painkillers. Paracetamol is a very common hidden ingredient. And now, for our final and maybe our most urgent section, what to do in an emergency and how to spot a potential overdose. You see, the tricky thing with an overdose is that the first signs can seem really minor, a lot like just having the flu really. Nausea, vomiting, sweating, maybe some stomach pain. But it's what's happening silently on the inside that's so dangerous. This slide right here, this might be the single most life-saving piece of advice in this whole explainer. After someone takes too much, they can actually feel perfectly fine for hours, sometimes even for a whole day. But during that time, catastrophic damage can be happening to their liver. That's why waiting for symptoms to get bad is the biggest mistake you could possibly make.
So, the action plan is simple, and it is completely non-negotiable. If you even suspect an overdose has happened, even if the person seems totally fine, you go to the hospital immediately. You call for emergency help, you do not wait. Getting treatment early can literally be the difference between life and death.
So, we'll leave you with this question. Look, paracetamol is a fantastic tool for pain and fever, but it demands our respect. The next time you reach for that box, will you take that extra 10 seconds to double check the dose and see what other ingredients might be in your other medicines? Because being informed is what keeps you safe. Thanks for joining us.